7 minutes past 10 from Women Radio 91.7, Nigeria's first and only radio station for women and their families. Glad to know that you're still there tuned in to this dial. Today is Friday, day 27 in the month of September 2024. How are you doing today? I really do hope that your day has been a very lovely one for you. And I also hope that you have been able to do all that which you mapped out for today. If you have not been able to do that, I mean, it's not too late, to go over them again. All right. And as always, I would always ask you this one. I hope you're doing your very best to stay healthy, by being intentional about what you take into your body, the food you eat, the water you drink, and of course, exercising your body and your mind. It is very, very important, particularly in this time and season where people are going through a lot. So you might just want to pay attention to your body and do your very best to stay healthy. My name is Blessing Agbeto, and this is why I get to welcome you to Radio Doctor. Radio Doctor is a free house consultation program where real doctors advise real people. Radio Doctor is Nigeria's first specialized radio health program where medical doctors consult for free and advise on your women radio. Radio Doctor is broadcast from 10 a.m. Mondays through to Fridays. My name is Blessing Agbeto, and our radio doctor for today is Dr. Abiola Ajayi, the MD of our Specialist Hospital. And yes, we'll be having conversations on the show for today. Good morning, Dr. Abiola. How are you doing today?
I'm doing very well. Good morning.
Good morning. Good
Thanks
to
for
have
having
you.
me.
Yeah, good to have you on the show today. All right, so on Radio Doctor for today, Dr. Abiola Ajayi, the Embassy of our Specialist Hospital, will be consulting and advising on understanding diseases associated with the breast. So that is what we'll be talking about today. For you to be a part of the conversation, you can always call us on 07000 917 917. Send us a text and WhatsApp message on 0703 175 6537. Log on to our website at www.thebfm917.com. Download the mobile app, the BFM 917. Sending your thoughts to our social media platforms, the BFM 917. That is how you can always be a part of the conversation. And yes, I need to say that at the end of the show, I'll be rolling out Dr. Abiola's number just in case you want to reach out to him for further consultation. You might just want to take advantage of that, to ask questions pertaining to your health. Anyways, let's delve into the conversation already. Understanding diseases associated with the breast. Now, I would like us to start the conversation exactly with the topic. Dr. Abiola, as a medical practitioner, what would you describe or what would you highlight as the most common diseases associated with the breast that women should be aware of?
Yeah, I'm happy that you brought this topic. It's so important. I want to talk about why it's important. Quickly, worldwide, breast cancer is the main cancer in women, and over 2.5 million new cases of breast cancer in the world come up every year. It's about 11.7% of all cancers. In Nigeria, breast cancer is the leading cause of cancer-related deaths in women. It's in some areas it's cervical cancer, but overall it's breast cancer, and it accounts for almost 25% or a quarter of all female cancers. And it is estimated about 100,000 women a year in Nigeria are being diagnosed with it. More than 16,000 have confirmed breast cancer every year, and over 10,000 Nigerians women die every year. And we're not great with statistics yet in Nigeria, so these numbers may even be low. So this is a topic that touches everybody. Everybody knows one woman or another in their life, and all of them can be affected. The breast cancer is the most serious breast disease, and that's what I was just giving statistics on. But and cancer is an uncontrolled growth of cells. So, our body is always growing. Just because we're adults doesn't mean our body is not growing. Our nails continue to grow, our hair continues to grow for most of us. Our skin cells continue to grow. So cells grow that when they're worn out, our body clears them and replaces them with newer cells. If there's something that affects that pathway or that process, where instead of cell growing at a normal rate, it now grows at 10 times, 100 times the rate, that's cancer. And typically you'll see lumps, bumps, or other tumors. Breast cancer, breast disease is not related, it's not limited only to breast cancer. There's something called benign breast conditions, and those are what we call things called fibroadenomas or fibrocystic breast changes. These are all non-cancerous lumps. And there's even something called mastitis, which is just inflammation of the breast. But so you have breast cancer, fibroadenomas, and fibrocystic breast disease. Those are probably the three most common breast diseases and the ones that are important for us to talk about.
All right, thank you very much for your thoughts on that on that one for today. So I don't know, can you just take us through all of this, particularly the benign condition? Because I know that there are times that a lot of people have said something about when you have few pains in your breast, you need to check it and all of that. So what if you feel pains on a particular side of your breast as a woman, and then you checked, you went for screening, and it was saying that okay, everything is fine and all of that? Should you still be worried?
Yeah, well, I like to say pain, no pain is normal. Pain is your body trying to tell you something. You know, your body can't really talk to you, but it can give you some different feelings. So if you're having pain in your breast, I would investigate it further until we figure out what it is. Now, it may not be breast cancer. It may be something called mastalgia. Mastalgia is breast pain, and that can result from hormonal changes or even changes in your social life, your emotional changes. But that's breast pain, and it's a sign of hormonal changes, and those hormonal changes can be usually fixed or addressed. The You have to be careful too. If somebody just tells you it's fine, well, how did they tell you it's fine? Was there a lump? Was that lump examined? If there was pain, was it associated with anything else? Were your lymph nodes? Lymph nodes are like train stations that carry immune cells. And if your lymph nodes are swollen, that could be a sign that there's an infection or even cancer. And there's ways to identify or examine lymph nodes. So, and then what type of scan was done? Was a mammogram done? Was history taken? A lot of that goes into the diagnosis of breast disease. Do you have anybody in your family that has breast cancer? Do you have anybody in your family that has thyroid cancer? Do you have anybody in your family that has prostate cancer? All of those, and we know prostate cancer is only in men, right? But all of those things increase your risk for developing breast cancer. So I like to take all that in addition to my physical exam, my scan, my mammo, and then give a person a comprehensive answer.
All right,
So
thank you.
you,
Yeah,
you asked
go on,
you
please.
asked about some of the benign ones. Sorry, I didn't answer it fully.
Okay, okay.
When you're younger, when I say younger women, these are, let's say, 40 and below. When you have a breast lump, it's typically something called a fibroadenoma, and that's the most common breast lump, and they're not cancerous, right? But breast cancer can also form as a lump. So if you have any lump, it needs to be evaluated. I prefer to remove all lumps and have them checked because, like we said, breast cancer is leading cause of cancer-related death in Nigeria. It's just not something to play with. Another important statistic or frightening statistic is that by the time the average woman is diagnosed with breast cancer, it has gone far. And that's what I'm hoping we're going to do on this program is educate women to do early detection. Early detection saves lives. And there's a lot that you can do as a woman at home to help with the early detection process. But by the time we diagnose with breast cancer, the average person in Nigeria, 75% of them do not live 5 years from that date. So, and that's truly what's unfortunate.
All right. All right. 07000 That is the number to call to be a part of the conversation. 07000 917 Send us a text and WhatsApp message on 0703 175 6537. Log into our website www.wfm917.com. Download the mobile app WFM917. Sending your thoughts to you. Our social media platforms WFM917. Download the mobile app, and yes, that is how you can be a part of the conversation for today. All right, Dr. Abiola, I mean, we've said some of those things, some of the diseases associated with the breast, and then we said common that women should be aware of. Now, let's flip the switch. Can men also suffer from breast diseases? And if so, what should they look out for?
Excuse me. Yes, men can also, men have breasts even though they don't use them to feed babies. Men can definitely suffer from breast disease and breast cancer, though it's very rare. It's about 1% of all breast cancers are male breast cancers. So 99% are women, 1% are men. And you should look out for any lumps, any swelling in your chest, any nipple discharge, and this is for men and women actually, but any nipple discharge, pain, and at times your nipple can change direction or invert. And of course, if you have any overlying skin changes, things like redness or dimpling, all of those could be signs of underlying breast disease. And truth be told, for men and for women.
All right, 18 minutes past 10 from Women Radio 91.7, Nigeria's first and only radio station for women and their families. Glad to know that you're still there, tuned into this dial. And yes, if you are just joining us, you're listening to Radio Doctor. Radio Doctor is your free house consultation program where real doctors advise real people for free on the show for today. And yes, you can call in to ask the doctor any question as regards your health. You can call us on 07000 917 917. That is the number to call to be a part of the conversation. Send us a text and WhatsApp message on 0703 175 6537. Log into our website at www.wfm917.com. Download the mobile app WFM917. Sending your thoughts to our social media platforms WFM917. That is how you can be a part of the conversation for today. Today on Radio Doctor, we're talking about understanding diseases associated with the breast, and Dr. Abiola Ajayi, the MDC of our hospital, and has been able to establish some of the diseases that are peculiar with the breast, regardless of the gender. So he has talked about breast cancer. He has also talked about mastitis. He says something about the benign conditions and what have you. Now, Dr. Abiola, I know that you've touched a little bit on breast cancer, but I would like you to pay more attention to it. Now, I would like you to, dig deep, like, what is breast cancer and how common is it in women and men? Because some people still believe that men don't have breast cancer. They think it's only a woman thing, not knowing that men can also have breast cancer. Dr. Abiola. Hi, Dr. Abiola.
Oh, sorry, I was on mute.
Okay.
Can you hear me now?
Yes, I can.
So breast cancer is a malignant tumor that starts in the cells of the breast. So like I said earlier, all of our cells in our body, breast cells, bone cells, kidney cells, hair cells are constantly growing. And when the old cells wear out, our immune system clears them and new cells replace it. This is part of normal living. But when that process gets over-amplified, usually because of a mistake or damage to a part of your DNA, that that process runs hyperspeed. So when in a span of a time period, maybe 100 cells will be developed in a cancer or malignant scenario, it may be 1,000,000 cells. And as it grows, it can form lumps or tumors in the area. We talked about benign breast disease, which can also have lumps right? The difference, and those lumps are obviously growing faster. The difference is one of them will have the DNA code for cancer, and the other one will not. So what makes that important is that typically benign diseases or non-malignant diseases may have a lump, but there's no chance that that cancer will now spread to other areas. But breast cancer, being malignant, not only can you have a lump in the breast, but over time, if it's not treated, the cancer can spread. That's really what devastates the patient with breast cancer. Not just a local disease, but it often spreads to the bone. So the bones of the chest, the bones of the spine. So the person may have pain in the breast, but also complain of back pain, complain of chest pain, complain of pain all over the body, and it's because the breast cancer has spread into those areas. When you look at images, sometimes X-rays or CT scans, even MRIs, for somebody that has metastatic breast cancer, meaning the breast cancer has spread, you can see holes in the bone where the cancer is really eaten out of the bone. That person is going to have pain. If you damage a bone, it's painful. So you can even see breast cancer in your spine. That's to support. Our spine supports our whole body. So if the spine starts deteriorating, your body can also start deteriorating and have pain. So breast cancer is that malignant process where the cells grow out of control and have the chance to spread through the body. The breast cancer is the most common cancer among women. It's about 25% of all female cancer. So, we have other cancers, breast cancer. The next highest one is cervical cancer. We have ovarian cancer. Some of these ones are all limited to women. Out of every four, one of those cancers will be breast cancer. In men, breast cancer is also significant, but it's very rare. About 1% of all breast cancer cases are male cases. I've seen a lot of breast cancer in my career. My aunt just passed away from breast cancer. May she rest in peace. But I've never seen breast cancer in men. However, it does exist and should look out for it.
All right, thank you very much for your thoughts on that one, Dr. Abiola. Now let's talk about this one. What are some of the early warning signs or symptoms of breast cancer, and how can it be detected early?
The best way for breast cancer or breast disease to be detected early is regular self breast exams. So, you actually, meaning you, the patient or the owner of the breast, is the most qualified person to talk about it because you're with it every day. And if a woman is doing regular self breast exams, then anytime a lump or a bump or any change occurs, that she'll be the first to see it and can alert your healthcare professional. Some of the signs that you're looking for are lumps, and especially lumps that are growing or lumps that have changed in size or new lumps, right? You're also looking for nipple pain, changes in the size of your breast, changes in the texture of the skin, as well as nipple discharge, especially if the nipple discharge is bloody. So at times, a woman can have nipple discharge when she's lactating or breastfeeding, right? There's times when women can have what looks like milky discharge when she's not pregnant or not breastfeeding, and that may be from a different type of tumor. And you can have bloody nipple discharge, which oftentimes is related to breast cancer, a particular type of breast cancer called an intraductal papilloma. But so the changes month to month as you're doing your self breast exams are the most important warning signs: lumps, nipple discharge, and changes in the skin.
All right, 07000 917 That is the number to call to be a part of the conversation. I know that you did a little bit of explanation on benign and malignant breast lumps. I don't know if you would also like to go further to explain the difference.
Yeah, I'm happy you asked the question again or in a different way because it's often confusing. And benign lumps these are like cysts. Cysts are just fluid-filled structures in the breast, or fibroadenomas. So benign lumps are non-cancerous and typically are not life-threatening. 5-year survival rates for somebody with a fibroadenoma should be close to 100%. And the most important part about benign lumps is they do not spread to other tissues. Malignant lumps are cancerous, and
Okay.
they can spread or metastasize to other parts of the body, which makes them especially more dangerous. So when we're talking about breast lumps, we have benign, non-cancerous, benign, which are non-cancerous, and we have malignant, which are cancerous. And the worst part about malignant lumps is that they can spread. And I mentioned they can spread to the bone. For breast cancer, they can spread to the lungs. They can technically spread anywhere in the body, but the common place we see it are the lungs and the bones.
All right, thank you very much for that explanation. At least now we know that the malignant breast lump can be cancerous, while the benign cannot be cancerous. So thank you very much for taking our time to explain to us what we need to know. 28 minutes past 10 from Women Radio 91.7, Nigeria's first and only radio station for women and their families. Glad to know that you're still there tuned into this dial. Thank you very, very much for choosing Women Radio WFM 91.7. My name is Blessing Agbeto, and our radio doctor for today is Dr. Abiola Ajayi, the MDC of our Specialist Hospital. And today on the show, we are discussing understanding diseases associated with breast. And he has been able to, highlight the diseases, talking about breast cancer, mastitis and whatever. And he has also established the fact that men can also come down with breast diseases. It's just that we have higher percentage in women than men. And then he has told us some of the early signs we need to pay attention to when it comes to breast cancer and how it can be detected earlier. And he also took out time to explain to us the difference between benign and malignant breast lumps. All of these are the conversations we've been having today on Radio Doctor. Radio Doctor is that radio program where medical doctors consult for free and advice on Women Radio WFM 91.7. Once again, my name is Blessing Agbeto. Now, Dr. Abiola Ajayi, how important are self-breast exams and how should they be done correctly?
So self-breast exams are part of early detection, and I didn't finish
Your thoughts
answering
the
that
other
that
time.
previous
Okay,
question.
thank you.
Early detection is possible through regular self-breast exams, as well as clinical breast exams, meaning your doctor, your healthcare professional is doing it. And I have some women that don't feel comfortable or are unable to do their monthly breast exams, and we can help them do that in the clinic. And there are also things like breast scans. The high frequency breast scan is a special type of ultrasound that you can use to detect lumps and bumps early. And then, of course, a lot of us have heard about mammograms, which is like an X-ray test, an X-ray of the breast. So all of those are types of early detection. When you're talking about self-breast exams, women should perform them monthly, every month of your life, usually a few days after your period,
Okay.
and they should be looking for lumps, bumps, changes in the texture, nipple discharge. I often tell women squeeze the nipple, try and see if anything comes out. Nipple discharge, especially bloody discharge. And the correct way to do it, you use your like the not the tips but the pads, like the ends of your finger, and you go around the entire breast in a circular motion. You go light at first, and then go deeper, and you must always extend your exam into the armpit. There's some of this called the tail of the breast. So the breast tissue actually extends into the axilla or the armpit. And you also have those lymph nodes. We talked about lymph nodes. Sometimes a large lymph node could be an early sign of breast cancer. So, and you'll oftentimes feel those in the armpit. So you do that, and then I tell women try and do it in front of a mirror if you can, so that you can look for any changes in the skin. There's something growing under the skin at times when you start manipulating or pushing the skin You may see some dimples or retractions or just some changes in texture, which can alert you. So every month, a few days after your period, looking
Period.
for lumps, bumps, and discharge.
All right, thank you very much for that one. A few days after your period, look out for lump and bump and discharge from your breast. Okay, thank you very much once again.
And
Now,
I want to just add something.
okay, please go ahead.
Once you've reached, because when do you start doing this? When do you start doing self breast exams? Is it age 5? Is it age 50? And I tell once you've entered puberty, you should start. Breast cancer does not have an age limit or yes, typically most cases are above the age of 40. But if you have a high risk factor, sometimes we start checking, doing mammograms as early as 30. And there are cases of people with breast cancer in their 20s. So once you've hit puberty, it's time to start doing your monthly. Puberty meaning regular. Your menses have become regular. You're having menstruation every month. You should now be checking your breasts every month.
All right, thank you for your thoughts on that one. So once you hit puberty, it is important that you check your breast every month because breast cancer is no respecter of age. All right, thank you very much because I know that's the next question I was going to ask you. The age we can start getting regular mammogram and how often. We've talked about breast examination, that's self breast examination. Now, talking about mammogram, are we supposed to carry out mammogram on teenagers as well?
Yeah, well, for mammograms, a mammogram is an X-ray test. So there's two plates that your breast is kind of squeezed in between, and pictures are taken, and it highlights breast tissue and the breast ducts, and it's part of our early detection. Women at average risk for breast cancer should start at age 40, and there's different. Before it used to be start at age 40 and do it every year. Recently we've said that average risk, no lump seen, you can do it every 2 years. So it's every 1 to 2 years from age 40. But if you have a higher risk, remember we had talked about from family history. So if any woman in your family, that's mother, sister, auntie,
Auntie.
grandmother, have had breast cancer, you have a higher risk. If you have a family member, close family member that's had thyroid cancer or prostate cancer or any other what we call secretory cancers, meaning of a gland of an area that secretes something, then that's another risk factor. If you have the genetic mutation, there's a gene. I talked about DNA. We'll talk a little bit more about that later, but there's a gene for breast cancer, actually multiple genes for breast cancer. If any of those are positive, I typically start at age 35 for mammograms. And in the literature, you can go as early as age 30. So, yes, puberty, women in puberty, we're not doing mammograms for them. We're doing self-breast exams. But as early as age 30 and definitely by age 40, you should have your first mammogram. If your first mammogram is normal and you don't have any family risk factors, I typically say repeat it again in 2 years.
All
And
right.
you continue like that for life.
For life. More like every two
Yeah.
years.
Every 2 years. Once women enter menopause, then we spread it out and we can even go up to every 5 years. But it's
So before
I'm
before
giving the ranges
menopause.
because people can be reading or following along, and in different sources may tell you yearly, or every 2 years, or every 5 years, and that's it. At the beginning, every year. If you have some normal ones, every 2 years without any extra risk factors, and menopausal every 5.
All right, thank you very much for your thoughts on the show for today. 07000 917 Send us a text and WhatsApp message on 0703 175 Log on to our website www.wfm917.com. Download your mobile app, WFM917. Send in your thoughts to our social media platforms, WFM917. That is how you can be a part of the conversation for today. Now, Dr. Abiola, can lifestyle choices such as diets and exercise reduce the risk of breast disease?
The short answer is yes. A healthy lifestyle can lower your risk of breast disease and breast cancer. And when we say healthy lifestyle, we're talking about reducing our risk factors or reducing our yeah, how these risk factors affect us. Can I dive a little bit more into the risk factors? Because just saying healthy lifestyle, people may not know exactly what that means. We have risk factors that make it more likely for someone to develop breast cancer. Some of the risk factors are things you cannot change. We call them non-modifiable risk factors. That's like your gender. If you're a woman, you're going to be at a higher risk, and I don't know about today's day and age, but you cannot change from a man to a woman or vice versa. Your age, you cannot change. As you get older, you get more likely to develop breast cancer. Your family history, you cannot change. And the genetics, where there's something called BRCA, BRCA gene 1 and gene 2. If you have those mutations, you have a definitely higher risk. If someone has early menstruation, meaning they started menstruating regularly earlier than most, or they end up into menopause later than most, those are also risk factors that are non-modifiable. Some of the ones that you can modify that you are in control of, and this ties into the healthy lifestyle, is obesity. Higher women that are higher in weight, higher risk of breast cancer and breast disease. Excessive alcohol consumption, smoking of any type, physical inactivity, so leading a sedentary lifestyle, and if you're on different types of hormone replacement therapy, taking estrogens and progesterones, those can affect your chance of developing breast cancer. So when we say yes, a healthy lifestyle can lower the risk, things that make sense: regular exercise, maintaining a healthy weight, reducing or eliminating alcohol, and eating a balanced diet or a diverse diet. So you're eating fruits, vegetables, your meats, it's varied, not sticking to one food. And what we've starting to learn now, even diets that are high in sugars and starches may also contribute.
All right, 07000 That is the number to call to be a part of the conversation. If you have any question you would like to ask Dr. Abiola, this is a time to ask. If you have any question you would like to ask, this is that time. So, what question would you like to ask Dr. Abiola on the show for today? If you think about it, how do you okay, so we have this question here. This one says, what is the major cause of all these diseases associated with breast, most especially breast cancer? Olushoga Ajayi from Odonla Ikorodu, and then he went for that. Doctor, okay, so he said, Doctor, is it true that touching breast more often can reduce breast cancer?
Okay. So I'll take it in
One after
reverse
the other.
order.
Okay.
I have not come across any study or any hard evidence that says that touching or manipulating the breast more reduces your risk. So I can't speak on that. If I'm just to say anecdotally, I don't think it would affect your risk. Now, if you are traumatizing the breast, meaning injuring the breast, this is more than just touching. This would be hitting, striking repeatedly. It could actually increase your chances. I'm thinking about somebody that's a fighter, like a woman boxer or so. If your breast is constantly being abused, there's a chance that could increase your chances of having breast disease. But just touching or manipulating should not affect it either upwards or downwards. I think the first part of the question was, what are the causes of some of these?
Yes, breast
Um,
diseases.
Yeah, and typically, well, even just for cancer, we have, I talked about the process where your body replaces old cells and puts in new cells. That code is in your DNA. So if your DNA gets mutated or modified where the code gets scrambled, then you can develop breast cancer. And we know for breast cancer, we know some of the regions, like the exact area in DNA. If that something happens to this area, more than likely this person will develop breast cancer. And those are what we call the BRCA, BRCA. I don't want to give the long term, but the BRCA1, BRCA2 gene mutations. We know that if those mutations occur, more than likely this person may develop breast cancer. So when we say causes, We know about DNA mutations, and then we now look at those risk factors. Somebody obese is not guaranteed to develop breast cancer, but we know that they can likely, the chances are higher. Those that smoke and drink, physical inactivity, all of those could be linked or are linked actually. Yes. Hope I answered this question.
All right. I really do hope that we've been able to answer your question on the show for today. 07000 That is the number to call to be a part of the conversation. Send us a text and WhatsApp message on 0703 1756537. Log into our website at www.thebfm917.com. Download your mobile app, the BFM 917. Sending your thoughts to our social media platforms, the BFM 917. That is how you can be a part of the conversation for today. My name is Blessing Agbeto, and if you're just joining us, you are definitely listening to Radio Doctor. Radio Doctor is your free house conversation program where we talk about your house basically. Okay, so we talk about your house, what you can do to enhance your house, and of course we promote good house on Radio Doctor. My guest today is Dr. Abiola Ajayi, the MD CEO of RRA Specialist Hospital. And of course, my name is Blessing Agbeton. Today on the show, we're talking about understanding diseases associated with the breast. Diseases associated with the breast, that is what the conversation has been about. And Dr. Abiola has established that lifestyle choices, such as the diet, exercise, have a way of impacting, the breast disease. All right, so Dr. Abiola, let me ask you this one. How do benign breast conditions like cysts differ from malignant conditions? I know you've differentiated earlier, but talking about cysts now.
Yes. Do you mind? I will answer that question, but I want to touch on something that just struck me.
All right.
Because we've said exercise, and you're always very good at summarizing, what we've talked about. And you've mentioned exercise, and I just don't want people to think that exercise is limited to going to the gym. Because a lot of people
Absolutely.
hear exercise and feel like, man, I'm too busy for that. Or, and I say you need to live an active lifestyle. But does he know how much work I do? Does he know I have to leave the house at 4 a.m.? Yes, I do know. I do know. And when we say exercise, it does not require you to get a gym membership. It just requires, for example, there's an exercise I prescribe to patients is doing 20 body weight squats. So you're just with your body, put your arms out, stand up, and just sit. When you try to sit down, you let your bum touch the chair and you stand up again. That's what I'm calling a body weight squat. 20 of those plus 20 jumping jacks. You do that over the course of 7 to 10 minutes in a day. That is exercise. And that has been just that amount. Do that 3 to 5 times a week. Not only will you feel better and look better, but it will reduce your chances of having breast disease, breast cancer, lung cancer. All these cancers and diseases are improved with regular physical activity. So I didn't mention you have to go and buy barbells or dumbbells, which I do like using those, but I didn't mention you have to go and get an expensive gym membership. Everybody has a chair in their house, or has a bed. Everybody has a room that they can do jumping jacks, right? So, and you don't have to kill yourself. If you just starting out, you do them slowly. What you'll find is that after about a week, 2 weeks, 3 weeks of doing them, they become easier. Your muscles respond. You yourself will enjoy it more because there's something called endorphins. There's a hormone that's released that makes you happy, and that hormone is released during exercise. So you just want to do it where your heart rate gets picked up. You want to maintain it for at least 5 minutes. The literature tells us 7 to 10 minutes. I've started doing it myself so that I can put my money where my mouth is, and so forth. And I love it. My knees started feeling better. I'm into every day for the last 3 weeks. My knees started feeling better. I have even more energy, even though I do exercise somewhat. But we're talking about in a week, 35 to 45 minutes in an entire week to save your life. It is worth it. So I like to challenge our listeners to try it. If you can't do 20, do 10. If you can't do 10, do 5. You can't do five, do one.
Just do
When I
something.
started that's it. When I started my recent exercise journey, let's say in the last 2 years, I have a gym in our compound. I have to walk past it to get home. My personal gym, never used it because I'm always walking. I'm tired. Let me go and eat first, or let me go and say hi to the kids first, or every excuse not to use it. So I now went and took the dumbbells out of the gym and put them right next to my bed. And I told myself, now you have to step over this to get out of bed. Pick them up. Just pick it up. The first day, I just picked them off the ground and put them down. In my head, I said, "You see, I picked them up." But the next day, I picked them up and lifted them for about 30 seconds. The next day, 1 minute. Now I'm up to 20 minutes, and
Wow.
I love it. And I can see my muscles are bigger, and everybody says, "Hey, you look good. You look good. What are you doing?" That's it. I just forced myself to do the exercise. And you're not trying to get healthy in a week. You're not trying to get healthy in a month. You're just trying to introduce healthy choices. So if you just move it once in a day, you do one jumping jack a day, eventually you're going to do more, and you're going to see the the
Results.
benefits. Yes, the
All
results.
right.
So that's a challenge to everybody that's listening, and tell your friend, just start moving. Really, just start moving.
All right, thank you very much for your thoughts on that one, Dr. Abiola. Now, I know that you've talked about family history, so I'm not going to bore you with that one. So let's talk about the treatment options. What are the treatment options available for patients diagnosed with breast cancer? Can people recover from it?
Yeah, so when we say treatment, the most important thing about treatment is what stage the cancer is in. So, for example, if the person is diagnosed with breast cancer, that means we've done a biopsy. We've found a lump, we've stuck a needle in the lump and sent it to the lab, or we removed the lump or part of the lump and sent it to the lab, and it now lab now says that's breast cancer. Once that has been identified, if it has not gone far in stage, the easiest way to describe a stage is, has the cancer left where it started? So if I have stage one breast cancer, it means it's limited to that lump. There's no other cancer anywhere. If I have stage two, it's gone a little bit further, probably in the lymph node in the armpit, or if I have stage four, is distant metastasis, meaning it's in the bone, it's in the bones of the pelvis or the bones of the chest. So the treatment is different. So the first line of treatment we would love to do is surgery. You have a breast lump, remove the entire lump, and we'll remove some of the healthy tissue around to ensure that we got everything. That's called a lumpectomy. At times, we do a mastectomy, remove the entire breast, multiple lumps, or you're worried that you may not get it, or to just reduce the chance of getting cancer again. For example, if you have a breast cancer and a breast lump, you remove the entire lump and leave the rest of the breast, fine. But that rest of that breast tissue still has risk of developing cancer, right? So at times you remove the entire breast so that the patient doesn't develop cancer down the road. So surgery is the mainstay. I like surgery in the early stages because it is a cure. If you remove all the cancer, then you've cured the cancer. But after surgery, especially for the later stage disease, and I'll repeat again, if you have a breast lump that's cancerous and it's also spread to the bones of the back and the bones of the chest and the ribs, can we go and do surgery and remove all those places? Can't remove all your bones, can't remove all your ribs, or so. Then we now do other treatments, and some of those other treatments are hormones. We've all heard of hormones, meaning anti-estrogen and mainly anti-estrogens, but we have chemotherapy. These are anti-cancer drugs that are given in the vein or IV, and you can also have radiation. So something similar to an X-ray that's trying to kill the cancer from the outside. The drawback to radiation, chemotherapy, and hormonal therapy is that they affect good cells and bad cells. So if I'm putting radiation on a breast, not only is the cancer cell getting some radiation, but the good cells are getting radiation, and that can cause other problems, things like fibrosis, developing different types of cancer. Chemotherapy kills good cells and bad cells. You're just hoping that it kills the bad cells before you kill the host, before you kill the patient. And that's why you oftentimes see people on chemo, especially for breast cancer chemo, throwing up, hair falling out, all kinds of other side effects of the chemo because it's toxic. It's toxic to all cells. So it's just stressing that the best, let me say, the best type of breast cancer to have is early stage. It's early detection is most important. You have a higher chance of curing it, higher chance that surgery is an option. You want surgery to be an option. And otherwise, if not, then we rely on the other ones. And then some of the newer ones are targeted gene therapy. So you know that this person has this gene mutation, and we target we make the therapy targeted because we looked at their DNA. We do that. We're doing that more and more these days, although it's still a bit rare in Nigeria.
All right, thank you very, very much. As we wrap up on the show today, Dr. Abiola, I mean, it has been an insightful conversation enlightening us on all we need to know about breast diseases, with the focal point being on cancer. Thank you very much for creating your time, as always, to be a part of the conversation for today. So, just before I let you go, what advice would you give to those listening to our conversation, but they are anxious about the potential of breast issues?
Yeah, best advice: early detection is the key. So be very proactive with your self breast exams every month, a few days after your period, every month. And any change or anything you feel, come into your doctor and start evaluating it. Then take part in screenings. So in clinical screenings, for example, you come into the clinic and doing a high frequency breast scan, this type of ultrasound scan, or doing your mammogram. Those things are very important. Not all breast changes mean cancer. Many conditions are benign, but you as the patient, you can't tell if this lump is a malignant cancerous lump or a non cancerous lump or a benign lump. So you need to have it checked out. If you're waiting, hoping that it goes away, or you're waiting hoping that it's not serious, and you now find out that it's cancer and it's now late, the chances of survival are much, much less. So early detection is by far the best advice um, I can give. On top of that, stay informed, continue listening to the WFM, live a healthy lifestyle, and don't be afraid to talk to your doctor.
All right, thank you very much, Dr. Abiola, for your thoughts on the show today. We say thank you for today's free consultation and advice on understanding diseases associated with the breast. Do well to enjoy the rest of your day.
Thank you. I like giving things away. If anybody hits us up on our socials, we will give away breast scans for the first 20 people.
Okay.
So find us on our social media page. I think you're going to give out the information.
Yes, I will definitely do that.
Thank you. And good. I want people to really take us up on it. It doesn't take time, and it could save your life.
All right, thank you very much for that, Dr. Abiola. Well, there you have it from Dr. Abiola Ajayi, the MD CEO of RA Specialist Hospital. Just in case you want to reach out to him for consultation, you might want to, reach out to Dr. Abiola Ajayi, MD CEO of RA Specialist Hospital on 0913 579 5108. 0913 579 5108. All right, you can reach out to book an appointment and, of course, for directions. You can also reach out to Dr. Abiola on any of the social media pages: ROA Specialist Hospital on Facebook, ROA Specialist Hospital on Instagram, ROA Hospital on YouTube, and, of course, ROA Hospital on X, formerly Twitter. Or better still, visit the website www.theroahospital.com. Many thanks to you for listening to the conversation on Radio Doctor for today. Radio Doctor on Women Radio, WFM 91.7, is Nigeria's first free consultation program. And of course, many thanks to the producer of the show, Aisha Sani, and the executive producer, Tom Okewale Shonaya. I will talk to you again on Monday when we come with a special edition of the Radio Doctor on Women Radio, WFM 91.7. In the meantime, at 12, we have the news at 12. At 11, we have the playlist. Keep it locked on to Women Radio 91.7 as we bring to you great conversations and great music to spice your